Hello everyone, we are students of Ashok Mane Institute of Pharmaceutical Sciences and Research SAVE. Today we are conduct the seminar on previous year questions of quality assurance. Questions: define the quality control, explain the quality control test for containers and rubber closures. Presented by Anuradha Rasa, Rishikesh Donalikar, Sanika Patil. Guided by Mr. A.N. Dhage sir. Quality control. Quality control is essential in pharmaceutical packaging to ensure the product safety and efficacy. The World Health Organization defines the quality control as the sum of all procedures undertaken to ensure the identity and purity of a particular pharmaceutical. According to Schedule M, quality control involves the sampling, specifications, testing, documentation, and release the procedures which ensure that the necessary and relevant tests are carried out and that materials are not released for use, nor products released for sale or supply until their quality has been judged satisfactory. Glass container testing. Chemical resistance test evaluates how glass containers resist the chemical attack from contents, ensuring the container integrity throughout the product shelf life. Second is powdered glass test. Determine glass quality by measuring the amount of powder glass produced when crushed and processed through specific procedures. Third is water attack test, used for containers exposed to sulfur dioxide under the controlled humidity, involving the autoclaving and titration to measure the chemical resistance. Fourth is thermal shock test, evaluates container resistance to temperature changes by transferring between the hot and cold water baths and examining the for cracks. Hydrolytic resistance testing. The test classification. Hydrolytic resistance test evaluate the glass containers to determine their type 1, 2 or 3. Test 1 distinguish type 1 and 2 from the type 3, while test 2 checks the surface treatments effects on the type 1 and 2 containers. Sample preparation. The number of containers and test solution volumes vary based on the container size. Containers up to 3 ml require at least 20 samples, while larger containers over 30 ml need at least 3 samples with 100 ml test solution. Cleaning procedure. Containers are rinsed with distilled water with closed ampoules heated in distilled water. Sealed containers are autoclaved in a water bath at 80 degrees Celsius filled with water to ensure proper preparation. Result calculation. Results are compared with standard tables for the volume of 0.0 m HCl used per 100 ml test solution with different limits of each glass type based on container capacity. Additional glass container tests. First is arsenic test. Test for arsenic contamination in containers for parenteral preparations by washing, treating, and measuring the absorbance against the standards. Second is internal bursting pressure. Evaluates container strength by the gradually increasing internal pressure until the container bursts, measuring the resistance to pressure. Third is light transmission. Measures the how much light phase passes through container sections using a spectrophotometer to ensure the proper protection from light. Fourth is annealing test. Checks for proper heat treatment of glass to prevent the stress points that could lead to container failure. Plastic container testing. First is collapsibility test. Ensures the squeezable containers yield at least 90% of nominal contents at required flow rate at ambient temperature. Second is light absorption. For parenteral containers, measures the absorption which should not exceed 0.20 in the 230 to 360 nanometer range. Aqueous extract clarity. Test container sections by washing, autoclaving at 121 degrees Celsius for 30 minutes and checking that extract is colorless and free from turbidity. Non-volatile residue. Evaporates extract to dryness and measures the residue weight, which must not exceed 12.5 mg per 100 ml of extract. Parenteral container requirements. First is clarity and color. Solutions extracted from containers must be clear and colorless, ensuring no contamination or leaching of materials that could affect the produce appearance. pH balance. Acidity or alkalinity test ensure the container doesn't alter the pH of its contents. The solution should remain colorless with pH changes matching the standards. Reducing substances. Titration results should not exceed 1.5 ml, indicating the minimal presence of substance that could chemically interact with the potentially degraded pharmaceutical products. Fourth is transparency. Containers must not show significant cloudiness compared to the blank, ensuring visual inspections of contents remains the possible throughout the shelf life. Rubber closure testing. Shelf sealability. Preparation. Fill the 10 suitable vials with the water to nominal volume. Close the vials with the prepared closures and secure with caps to create the test samples. Needle piercing. For each closure, use a new hypodermic needle with an external diameter of 0.8 mm and pierce the closure 10 times, each time at a different site to test multiple punctures resistance. Pressure testing. Immerse the vials upright in a 0.1% weight by volume solution of methylene blue and reduce the external pressure by 27 kPa for 10 minutes to simulate stress conditions. Evaluation. Restore the atmospheric pressure. Leave vials immersed for the 30 minutes. Then rinse the outside. Pass criteria. None of the vials should contain any trace of colored solution. Rubber closure testing. Fragmentation. Acceptance criteria. Total fragments must not exceed 15 except for butyl rubber. Fragment collection. Pass liquid through 0.5 micrometer filter and count visible fragments. Needle piercing. Use new needle for each closure. Verify it remains sharp. Sample preparation. Prepare 12 vials with water or dry as appropriate. This test is specially applicable to closure intended to be pierced by hypodermic needles for aqueous preparations. Vials are filled with water corresponding to the nominal volume 4 ml, closed with prepared closures, and allowed to stand for 16 hours. For dry preparations, clean vials with prepared closures are used directly. The fragmentation test ensures that rubber closures don't shed excessive particles when pierced, which could contaminate the pharmaceutical product and potentially cause harm to patients receiving injections. Thank you.